Hey guys, how you doing? Just a follow-up to my video from yesterday. Um, we've got some new information. It was announced by Pritzker, Governor Pritzker, that the schools in Illinois will be closed for a period of about 2 weeks, roughly till the end of March, because of the coronavirus. So I went on to the CDC's website, and basically what they said was the indication for school closure is if there is a case of coronavirus, COVID-19, in the building. They recommend closing the school for 2 to 5 days for sanitation practices of the building, and for health officials from the Department of Public Health to be able to track people who have been exposed to this particular person. So, not sure why they're closing for 2 weeks. It's really not clear because they're not going along with the recommendations from the CDC. There's a couple things I just wanted to share, which, again, this is directly from the Center for Disease Control's website, which is probably the most reputable, that in the World Health Organization, most reputable source of information. And you can look this up on your own, but I figured I'd share it with everybody. So coronavirus, to date, as of today, March 13th, Friday the 13th, there are 46 cases of coronavirus in Illinois. There have been no deaths attributed to coronavirus thus far in Illinois, thankfully. Nationwide, there are 2,110 cases of coronavirus so far, and a total number of deaths of 48. In contrast, influenza, which nobody really seems to be concerned about, so 36 million cases of influenza this year in the United States. 36 million. 370,000 hospitalizations due to influenza, and a total of 22,000 deaths. In that 22,000 deaths, there are 144 pediatric deaths from influenza this year. The rates of flu for children 0 to 4 and adults 18 to 49 years are now the highest the CDC has on record for these age groups. Yet no one seems to be concerned about influenza. All the hype is coronavirus, of course. Now, to be fair, when you look at the mortality rate of the flu, it's approximately 0.06%, and the mortality rate for coronavirus is about 2.3%. Now, inherently, in my opinion, there is a test bias, which means we're only testing people who have severe disease in terms of coronavirus. We haven't been able to test and identify people who have had coronavirus with very mild symptoms. I think once we have a way to test for exposure to coronavirus, those who had very mild symptoms, such as an antibody test, which is being developed in this country, I think we will probably see that exposure is much, much, much higher this will in turn reduce the mortality rate significantly, I suspect. Anyhow, just wanted to share some updates with you in regards to that. In terms of preventive practices, again, limit public transportation, public gatherings, protect yourself in terms of frequent hand washing for 20 seconds, which is quite a long time if you really think about it, but that tends to be the adequate amount of time to remove bacteria and viruses from the hands. And make sure that people